Hi, this is Arun Bangarappa. Join us for an enlightening discussion with Dr. Bharadwaz, CEO and Chief Doctor at Fidicus Homeopathy, a prominent homeopathy doctor at Manikonda, Hyderabad. We will be addressing the Chandipur virus, a modern viral challenge, and examining how the homeopathy can offer unique and effective treatment on this. Now, Dr. Bharadwaj will going to share his extensive knowledge regarding how the homeopathy can manage especially these kind of viral infection. To begin, can you provide us with an overview of what the Chandipur virus is, including its origin and how it affects the human body?
Chandipur encephalitis or Chandipur viral encephalitis is a viral disease. It is caused by the virus known as Chandipur virus. This is a rare disorder, but it's a deadly disease. What happens in this disease is there will be inflammation of the brain. This is encephalitis. We call it as encephalitis. This is a rare disorder where the brain get inflamed. There can be redness, there can be swelling, there can be lot of edema. All the issues are related to the brain, and it is a very rapidly progressing, very acute disease that leads to the death of the kids. Normally, it occurs between the ages of 9 months and 14 years. The kids between 9 months and 14 years are more prone to it than compared to any other age group. The problem with this disease is it causes more than 50% of the death. In India, it is recorded that there are 100 patients, more than 50% have died because of this disease. And coming to the treatment, there is no specific vaccination or there is no specific protocol for treating this disease in allopathy, but in homeopathy, you can handle it better. Sometimes you can prevent the disease, you can reduce the intensity, duration of the symptoms. Whether it is in first stage, second stage, or third stage, homeopathy has very good scope in it. It doesn't mean that allopathy or English medicine will not work. There is absolutely importance of allopathic treatment here. When there is high fever or convulsions where the kids go into epilepsy, you can use some steroids. There is absolutely scope for allopathy here as well. It doesn't mean that only homeopathy treatment is going to work here, but definitely it is first stage, second stage, or third stage of the disease. Homeopathy has absolute importance here as well. As you know that Japanese encephalitis, previously homeopathy has prevented the disease and also helped in curing the disease, protecting the children from this disease. In the same way, even in this disease, homeopathy can be used in any other stage, even for prevention of the disease as well. And coming to the statistics, this disease was first identified in 1965 in Chandipur village of Maharashtra. So it is the first time in the world this disease is identified. And in Andhra Pradesh, this disease is first seen in 2003, where 329 kids are affected by this disease. Out of them, 183 kids died because of this disease. In the same way, this disease is seen in 2004 in Gujarat. This disease is also seen in 2009, 2010, and also 2012, 13, 14. And the recent episode is in 2024. In June 2024, it again has come back in Rajasthan, Madhya Pradesh, and Gujarat, where it is affecting 14 kids. Out of these 14 kids, 8 kids have already died, and rest of the kids are under the treatment, and hopefully they are doing well.
Earlier detection of symptoms can be key to effective treatment and management of any virus. So, could you explain what symptoms individuals should be aware of this to identify a possible Chandipur virus infection?
Coming to the signs and symptoms of this virus, it is very important to understand because there will not be time for the investigation, going back to the lab, testing the virus. So everyone has to be aware of the symptoms of the virus. The symptoms are very rapid. Initially, there will be symptoms of the flu like mild headache or severe headache, fever, body pains, and also there can be nausea and vomiting. Nausea means there will be sensation of vomiting. These are the initial symptoms. Within 24 hours, the symptoms become severe, like there will be convulsions means epilepsy in the kids, and also severe headache. There will be lot of confusion in the children. There will be disorientation. There can be illusions, delusions, hallucinations. Illusions means children will think of one thing as another thing. For example, if there is a pen in your pocket, they think it as a gun. And also coming to delusions means they will have strong opinions like something is inside the home, some robbers are inside the home, or some animal is inside the home. These are known as delusions. And coming to hallucinations, which is not in front of their eyes, they think that there is something, there is a ghost in front of them, or there is someone who has died long ago or in front of them. These kinds of delusions you can see in the second stage of the disease as well. They can be diarrhea means loose motions. There can be these symptoms in the second stage as well. And coming to the third stage, it is the deadly stage where the kids go into coma and they go into death. So the important thing you have to remember here is there is no time for the investigations. That's the reason they have to go immediately, they have to get admitted in the hospital, and they have to be treated immediately so that the prognosis is good.
How to identify the right test is crucial for diagnosing the viral infections effectively. And what are the key diagnostic tests for this Chandipur virus, and how do they contribute to precise diagnosis?
So coming to the test and investigations, they are not much important. So because the disease progresses rapidly, they can take the blood samples and send it to any big lab where they can identify the viral RNA. That is possible, but we don't have time for that. Mostly, it has to be diagnosed based on the symptoms. If any kid is suffering with these symptoms, so you have to refer them to the higher center immediately.
To tackle the Chandipur virus effectively, it is crucial to understand its origin and causes. So, can you explain what factors contribute to the emergence and the spread of this Chandipur virus?
The cause for this deadly disease is a virus that is known as Chandipur Virus. This virus is rarely seen, but the main carrier of this virus is sandfly. Sandfly is commonly seen in the remote areas or villages of this country where the houses are made of mud, or the houses where they host cow dung. Cow dung and the mud houses, the crevices in the mud houses and the crevices in the dung, dry dung, these sandflies will develop there and they will go and bite the kids. When they bite the kids, those kids will develop these symptoms. Apart from these sandflies, it is also transmitted through mosquitoes and also ticks. Ticks and mites are also known to be transmitting this disease, but mostly it is due to sandfly, where the larva of the sandfly can easily grow in the crevices of the houses made of mud and also in the crevices of the dung. So in India, it is common practice that dung is used for various reasons. It is used as fuel, it is used to clean the floor, or it is used for various things. When it is stored and it is dried, in that these sandflies can develop.
To grasp the full impact of the Chandipur virus on the body and its importance to understand the specific physiological and biochemical changes it includes. So could you elaborate on the changes that occurs in individuals infected with this virus?
Once the kids are affected with this virus, the virus go into the brain. There it produces inflammation. Produces inflammation means it releases lot of inflammatory mediators where it will damage the brain and spinal cord. To the brain, it causes redness, it causes swelling, it causes edema. Edema means accumulation of water there. So lot of brain damage is done by this virus in the early stage within 24 hours of investing the person.
If you come into the unique challenges is nothing but the treatment. So could you provide the insights into which treatment approach might is the most effective, and how do allopathy, Ayurveda and homeopathy compare in terms of managing this Chandipur virus, considering the aspects such as effectiveness, safety and overall stability for this particular viral infection?
Yeah, there are two types of treatment. We will discuss about both. One is conventional treatment, is also known as English medicine, also known as Western medicine, or also known as allopathic way of treatment. The treatment where you go and take in a corporate hospital or a neurologist. Here, it is very important to remember that the allopathic treatment has a very important place. So there is no specific vaccine or specific medicine for this disease, but symptomatic treatment it is very important. If there is high fever, you can use antipyretics like paracetamol. If there is high pains, you can use painkillers. And also when the kids get convulsions or the epilepsy, anti-epileptics can be used in this case. And also the very important medicine we use here is the steroids. Steroids plays a vital role here to minimize the damage that is caused to the brain. So allopathic treatment has a very important role to play in this type of disease. And coming to homeopathic treatment, homeopathy treatment is also very good whether the kid is in the first stage of the disease where there is only slight fever, nausea, vomiting and also mild headache. So even in that stage homeopathic treatment is very effective. In the second stage where there are a lot of illusions, delusions, hallucinations, convulsions, high fever, so in that stage also homeopathy is very critical. Even in the final stage where the patient is unconscious and is about to die, in all the three stages homeopathy has a vital role. You can take homeopathy in all these three stages because homeopathy doesn't care about the disease. What it can be a simple disease where the medicine is available, or a complex disease where there is no medicine. Homeopathy treatment is based on the symptoms. If any disease has the symptoms, it has an answer in homeopathy. In the same way, even for this disease, homeopathy is very useful. How homeopathy can help is, it is of two types. One is you can prevent this disease. Even in past, homeopathy is used to prevent lot of encephalitis. Japanese encephalitis is famous for homeopathy. Homeopathy has prevented and given as preventive for Japanese encephalitis. In the same way, this medicine also can be given as prevention. So once you give it as prevention, it can completely stop the development of this disease. Or if the disease develops, there can be low intensity of the symptoms, low duration of the symptoms, low frequency of the symptoms. All the intensity of the disease is decreased. Sometimes it can prevent you from going to hospital and admitting. Sometimes it can reduce the hospital stay. So sometimes it can prevent you from going to the death as well. So in all these stages, it has high chance that it can prevent the disease. If not, if already the disease has occurred, it will reduce the intensity of the symptoms, frequency of the symptoms, duration of the symptoms. Mostly it will be helpful in almost all the cases. But you have to remember, allopathic treatment is also very important. You have to take this treatment along with the allopathic treatment. You should never consider this as the primary way of treatment when the disease is already progressing. So homeopathy should be used as the secondary line of treatment, but it has its own importance. And it is very important for other systems of the medicines to know that homeopathy has very good treatment. They can use homeopathic treatment along with allopathic treatment in any of these stages.
So if you come into the precautions, what are the key precautions individuals should be take to prevent infection with the Chandipur virus?
And coming to the precautions, it is very important to know that this disease is transmitted by sandfly and also mosquitoes and also ticks and mites. So you have to wear the cloths, especially who are in remote areas and the villages where this virus is already prevailing. So you have to make sure that you use mosquito repellents or insect repellent creams are available. You have to cover your entire body with cloths having full sleeve shirts or long pants with shoes. All these are very important. And also ensure that the mosquitoes are not developed, or you can leave some live fish in the places where there is lot of water stagnation. And also ensure that there is no water stagnator in and around the houses. Use mosquito nets and many other modes of mosquito repellents, like you can use the mosquito coils or mosquito repellent liquids. So all these can be used so that the mosquitoes bites can be prevented. In the same way, ensure that the entire house is clean. There are no crevices in the house, or no dung kept in the house, dry dung kept in the house, so that the sand flies will develop there and they bite the people. Apart from this, as a general rule, you have to have good sleep, good diet, regular exercise, stress free life, and also keeping out of habits. Keeping the habits out also helps in improving the immunity, so that if you get the disease, so you are resistant to that disease for some extent.
So what are the dangers we can observe if you neglect this Chandipur virus?
Yeah, coming to the prognosis. So what happens if this disease is not taken care? Within 24 hours, if the disease is not taken care, the kids will go into coma and death. That's the reason early identification and treating the kids and referring them to the higher center is very important in this disease. Finally, there is no need to panic. So here allopathic treatment is very important. You can use painkillers, you can use steroids, you can use antiviral drugs, and also anticonvulsants in the emergency cases. Along with that, use homeopathy. It is very important. Homeopathy can prevent this disease to the most of the extent, and also it can help in reduction of the disease in first stage, second stage, or third stage. The important thing here to remember is everyone should be educated, especially the parents of the kids who are in between 9 months to 14 years, and also grandparents, and also all the allied medical systems have to remember that there is very good treatment for this disease in homeopathy in all the three stages. And also use all the mosquito preventing methods. Whatever the mosquito preventing methods are there, you can use them.
So finally, what you're going to give the messages for our viewers regarding this diseases? This is a very rare diseases, or very deadly dangerous, or it is a communicable, or it's look like a pandemic.
No need to panic, because ICMR, Indian Institute for Medical Research, and National Institute of Virology is well aware of this disease, and they are on top of it. So no need to panic. And also, this disease is not like a pandemic. It will not go to every kids and every state, every place. This disease is now isolated and very small cases, very sporadic cases in Gujarat, Maharashtra, and Rajasthan. No need to panic about this. But important thing is, Be very careful if your kid is between 9 months and 14 years of age, especially the parents has to be sensitized, and also all the medical fraternity has to be vigilant about this, but there is absolutely no need to panic.
Fidicus Homeopathy